With the current infectious diseases threatening New Zealand, we think it's very, very important to ensure that our primary care team know in exact detail of how to put on and take off their protective equipment. The mainstay of maintaining the safety of our workforce is personal protective equipment. Hand washing, good hygiene, social distancing, but being able to work with our patients and keeping our staff safe is the most important thing on our agenda. This video has been designed to show you in very simple steps how to keep yourself safe while putting on protective equipment, and then even more importantly, how to safely take the equipment off so that you minimize the risk of contaminating yourself or others in your practice.
Where practical, put on your personal protective equipment before you enter the room. Otherwise, maintain at least a 2-metre distance from the patient. Wash hands with soap and water or use an alcohol-based hand sanitizer before putting on all personal protective equipment. Fully cover torso from neck to knees, arms to end of wrists, and wrap around the back. Fasten at the back of neck and waist. Secure ties or elastic bands at the middle of head and neck, or behind ears. Fit flexible band to nose bridge. Fit snug to face and below chin. Place eye protection over eyes and adjust to fit. If you wear glasses, place the eye protection over the top. Make sure gloves extend to cover wrists of gown. Make sure to keep hands away from face. Limit the surfaces touched. And change gloves when torn or heavily contaminated. Peel off first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove. Discard gloves in a clinical waste container. Perform hand hygiene. Remove eye protection from the back by lifting earpieces. If reusable, place in designated receptacle for processing, otherwise discard in a clinical waste container. Unfasten gown ties, taking care that sleeves don't contact your body. Pull gown down away from neck and shoulders, touching inside only. Turn gown inside out. Roll into a bundle and discard in a clinical waste container. Perform hand hygiene. Grasp bottom ties or elastics of the mask, then the ones at the top, and remove without touching the front. Discard in a clinical waste container. Wash hands or use an alcohol-based hand sanitizer immediately after removing all personal protective equipment. After the patient has left, wear gown and gloves and wipe down all hard surfaces with a virucidal disinfectant. Reusable eye protection and medical equipment that has touched the patient must be wiped down with a virucidal disinfectant. Dispose of wiping agents in a clinical waste container.
Hopefully you've been able to follow the video and see how you can use this within your practice teams to ensure the safety of your team, but also to provide some confidence in using this equipment. Protective equipment is really good, but it doesn't work if it's sitting in a drawer somewhere else. It needs to be put on and used properly. If we can maintain good infection control in our practices, that is going to be the mainstay of us dealing with any infectious agent that we may come in contact with. So please show this video to your staff members, look at it again, and then possibly even more importantly, do some trial runs within your practice of how to put it on and take it off, even to the extent of taking a dummy patient through the whole process in your practice. Once we've got that, you'll iron out the little holes that you may see in your processes, and then you'll be able to improve your safety. So go on, try it, but most importantly, good hand hygiene, good PPE use, and good infection control.